So as you can see, our average daily number of new cases of COVID-19 continues its steady decrease. As of February 15th, the average number of new cases is around 4,500, which is a 70% decrease since the peak we experienced in early January, when we reported an average of over 15,000 cases per day. Our optimism around this decrease is cautious. This number is still more than 3 times the average daily cases we reported in September. Also, we're at the time of year when people may be more tempted to gather. It's our hope that everyone who lives in LA County is choosing not to gather together with people from outside of their household or to travel to celebrate the Lunar New Year, Valentine's Day, and President's Day. The only way for us to continue to slow transmission is for everyone to choose safety this upcoming weekend and spend time celebrating the weekend's holidays just with members of your household and making plans to connect virtually with all others. Next slide, please. Hospitalizations of people who've become seriously ill from COVID-19 infection are also continuing to gradually decline, though the numbers again remain high. As you may recall, we reached a peak of over 8,000 average daily hospitalizations on January 6th. That was a more than 900% increase from the approximately 760 hospitalizations we were experiencing in the county when the surge began in early November. As of February 5th, there were 4,608 average daily hospitalizations, which is a 42% decline. It is encouraging to see these numbers go down, and we are grateful to everyone whose careful actions are making this possible. However, our hospitals are still very crowded, and they still have limited ICU capacity. If everyone can do their part to prevent transmission, we can reduce pressure on our hospitals by decreasing the number of people that end up getting very sick from the virus. This will enable hospitals to have the staff and resources necessary to accommodate other types of medical needs and procedures that have been delayed because of the high numbers of COVID-19 patients requiring intensive care. Next slide, please. Unfortunately, the number of people who are dying from COVID-19 remains distressingly high. The average number of daily deaths from COVID-19 peaked earlier in January at 220, which was an increase of more than 1,700% from when the surge began, and we were reporting 13 deaths a day from COVID-19. As of January 31st, the number of people who passed away from COVID-19 dropped by 45%, although we continue to report more than 200 people passing away on far too many days. Unfortunately, with hospitalizations remaining high, we can expect that more people will pass away from COVID-19 in the coming weeks. For death rates to significantly decrease, case rates need to drop much lower. This is why it's so important to recognize that now is the time to take more precautions, not less, if we want to support forward movement in our recovery journey. Next slide, please. So this graph of the combined trend lines for cases, hospitalizations, and deaths through January 31st shows what I've been noting is the rate of decline for all 3 metrics. Cases in the green line are falling at a very promising rate, but hospitalizations and deaths are not dropping at a similar pace because there's a lag time in cases for hospitalizations and deaths. In the weeks ahead, we need to see our daily case numbers continually declining. Until we can get to much lower daily numbers, community transmission remains widespread, and there is significant risk in every action you take outside your house. The variants are concerning because if we let our guard down, the more infectious strains can become dominant, making it easier for the virus to spread.